Hello and welcome to another episode of Medical Imaging Matters, the official podcast of AHRA. My name is Jason Newmark. I'm the Executive Director of AHRA, and I'm your host. So in today's episode, I'm joined by one of AHRA's most engaged members and someone who I truly enjoy, Lisa Walling. Lisa is the Director of Radiology at the Oklahoma City Indian Clinic in Oklahoma City, Oklahoma. And she is fresh off her experience as a member of AHRA's 25-26 Leaders of Choice cohort. And during our conversation, Lisa shares a truly fantastic story of leadership in action, specifically about her Capstone project. So during this project, Lisa and her team aim to expand accessibility and the use of vital screening programs in her community. And you know what? They really delivered remarkable results. So as we talk, she shares how her team made this happen. She discusses strategies that worked, lessons learned, and overall the passion that fuels her and her team's efforts every day. And you know what? That's not all though. Lisa also opens up about her membership journey with AHRA that began only 3 years ago. She highlights the power of being an active AHRA member, the value of networking, of mentoring, of sharing best practices, and simply stepping outside your comfort zone to grow as a leader alongside peers and colleagues. Now, I may be partial, but I really enjoyed our conversation. I found it to be both inspirational and energizing. So folks, settle in, and I hope you enjoy. All right, so Lisa, I'm so excited to spend some time with you this morning. It's a good way for me to start a Friday, a little snowy day in New England, and I get to chat with you. So I'm very excited. I think there's a lot of great stories and a lot of great perspectives you can share with our AHRA members and other listeners just about your career in imaging and some of your successes as of late. So we reached out. So really excited. So thank you for being here this morning.
Well, thank you for having me. It's really an honor, and I'm excited to talk to you today about how AHRA and Leaders of Choice has impacted not just myself, but my team and my organization.
I love it. I love it. So before we're diving in, by the way, I saw your screen behind you when you were starting up. Was that a baseball celebration? I remember you're like, aren't you like a huge advocate? I kind of remember you saying you were trying to hit all major baseball stadiums. Yep. I'm so curious. Like, did you get to them?
We have not. We have not gotten to all of them yet. We've pretty much got all of the West Coast, and now we're getting ready to start hitting all of the East Coast.
All right. And baseball seasons are right around the corner. Was there a baseball poster that I saw? Like the
It was one of the newspapers when the Rangers finally won the World Series a couple of years ago. So, yeah.
I can really being a Red Sox fan, I can relate to the finally winning perspective. So that's good.
The drought. Mm-hmm.
Yep. The drought. Anyway, I digress. So I'd love maybe get started. I mean, I know a little bit of your background, but maybe just give a little background of, how you got into imaging and maybe then kind of leading up to how you found AHRA. I'm always curious about people's pathways, and I think it will help set the stage.
Sure. So I've been in imaging for 24 years now and started my career down in Texas. Found AHRA back in 2022. And when I found the Certified Radiology Administrator program. And so that's kind of what led me into AHRA. And I signed up towards the end of 22 and sat for and passed to receive my credentials for CRA in May of 23. And I jumped on a My Way call. And next thing I knew, that was in June. Next thing I knew, I was on my way to Indianapolis for the annual meeting 1 month later. And
the 50th anniversary one. That's a big one to go to.
And so, I went to my first annual meeting in Indy and was hooked. AHRA got me. And so, I've been a part of AHRA since 2022. And it was in Orlando where I heard about the Leaders of Choice program. And so threw my hat in the ring for that. Was really excited about the opportunity because it kind of stretched me. It made me push outside of my little comfort zone. And what really excited me about that program was the Capstone project, because it helped me, go from planning to execution.
Yeah.
In a really, a relatively short window of time.
Yeah, and we're going to definitely dive into that. There's just so many little things. I got to jump back. Now my memory is jogging. You were the one on that My Way call back in the day that
I
said
was.
trouble getting funding, and I think Becky Allen or someone said, "I have a way to help you," and had like discounts or something. Right? Were you that person on that call?
It wasn't, I didn't have trouble getting funded. It was, I didn't even know anything about it at that time because I had literally signed up for the CRA in like October or November and sat for the exam. I mean, I studied, sat for the exam in May. And then I was like, okay, I've got these credentials. Now what? And so they had the My Way call in June. And I really still at that time didn't know that much about AHRA. Yeah. So I got on the My Way call to find out. And Tom Wall was like, well, you got to come. And so Becky graciously donated points so that my registration fee was waived. And then Tom took it upon himself to reach out to my VP and was like, you got to send her. And so my VP was like, okay. And next thing I knew, I was on a plane to Indianapolis. And, as soon as I walked up to the registration desk, Jessica Harjo was there. And she's like, you made it. And I've been part of the family ever since.
I just love that story. It's such a great example, like you said, of, you find AHRA, you kind of raise your hand, you try to figure what's out there, and just so many people will see you and just bring you in, right? Yeah. Everybody wants you to be part of the family. And it's just it's a great example. It's resonating now because I'm ever hearing about you. Now it's all clicking, the background of how you got there, because you're very visible in AHRA now, just because I've seen you at the annual meetings, and you've done something that I'm hoping we can have the listeners or people that are looking to get involved with AHRA is just raise your hand and just ask, right? You started raising your hand and say, how do I write an article and how do I get involved? And I love that you applied for Leaders of Choice. That was the year that we were kind of resetting the program with our partners at United Imaging who sponsor it. So thank you to them. And you were that first sort of reset class, which was a big deal for us. Because I remember we were scrutinizing who we were going to let into the class, and we wanted, you never know till you put people together. And it's amazing. I totally forget about all these parts till we start talking, right? So it all starts to resonate. I also remember you had that commonality with Becky, right? You won't drink Pepsi. You're a Coke person, Diet Coke, right?
It's exactly Diet Coke all day, every day.
It makes me laugh. Becky Allen, right? Do not show up to with a Pepsi with Becky Allen. She only loves her Diet Coke. Becky, if you're listening, I apologize, but I love you for it. All right. Anyway, so I'd love to dive in here then. So I love the journey to AHRA. I love that you very quickly got involved, and that Leaders of Choice program, I think, is where I've gotten to know you, and I've gotten to see you, transform over the last year and a half or so. And like you said, you talked about the Capstone project that every one of you and we had to work on throughout the year, and then present to the leadership of United Imaging and AHRA and your peers at the annual meeting. And I think that's why we were reaching out to you, is I thought your story was just amazing, right? I mean, there's progress, and then there's what did you do and how do you share your story, right? So maybe, do you want to just walk through a little bit about like how you found your topic, what the challenge was, and sort of how you came about getting the project together, right? Because obviously it's an island of one, but it's an island of many, right? To move forward.
Right.
So maybe just level set on what the project was. Yeah.
So my project ended up being, how can we increase screening exams in the Native American population that we serve? And, when you're in that cohort, you do kind of judge yourself against everybody else. And, I was like, does my project really have the meat that some of the other projects had? And ultimately I was like, you know what, I'm going to go with this one because I really feel like this one can make an impact. And so for anybody that wants to do the Leaders of Choice program, I would say, don't judge your project up against anybody else's. And so Oklahoma has been a very unique experience for me. When I lived in Dallas, Fort Worth, or Phoenix, patients had their little bubble. And if you are not within that little bubble, patients just didn't tend to come to your facility because they had so many more options. And here in Oklahoma, patients will drive hours to get to us. But we were realizing that a significant amount of our patients just weren't getting those necessary screening exams. And so how could we capitalize on increasing those exams for our patients is kind of what I built my capstone around.
And you mean by screening, you went the whole gamut, right? Not just like my mind goes directly to like, is it mammography? Is it lung screening? I think you had a couple other elements there, right? What you just want to make sure the listeners understand when we say screening, what were the 3 or 4 programs broader than just mammography?
So we did focus on screening mammo, but we also looked at bone density scanning. We looked at CT, low dose lung cancer screening, and calcium scoring, CT calcium scoring. And then about midway through our project, we were able to bring in GE's ABUS, the automated breast ultrasound screening for our patients as well. And so we kind of brought that into the data as well.
Right. So just an example of you being able to partner with a vendor as well for some of their technology to help you guys progress some of those things, which is something that we say often with, the AHRA members and just in general, is that it's not just a transaction, right? When you're working with these vendors, you can make it that way if you're just looking to save dollars. But at the end of the day, when you really partner up with them and maximize their capabilities, I don't know, maybe you can speak. It's funny you mentioned that. Not that I'm trying to go down the path on the GE side, but I just always find it really interesting that we miss those opportunities to take advantage of what other offerings or support that our partners in the corporate side can bring to us versus just here's your machine, go turn it on, right?
Yeah. And we had actually received a grant and they were wanting to focus those dollars towards women's health. And it was just the perfect storm. I had the perfect timing, and GE had come and presented the ABUS technology. I actually had a place to put it. And so it was just destined. And it has really helped us educate patients about dense breast tissue and the need for just screening in general. It was a great tool so that we could kind of jump into this is why screening exams are important and educating our patients, which was a huge part of the capstone was education.
Yeah. So can you speak to this? I was curious about that, right? Obviously, you're working with a population that, maybe historically is a little more adverse to getting some things done or doesn't appreciate the interest or didn't have access to it, like you mentioned earlier. But maybe you could speak to a little who you partner with to get that message out and that sort of the community outreach piece. And was it like direct to consumer? Was it working with the referring providers? Was it a mix of both? This is just so interesting to me.
Yeah, all the above. So we have a phenomenal community development team, and they were great in helping us utilize social media platforms, create flyers that we were able to utilize in different areas of the facilities, and then really working with our primary care providers and our specialty providers. And then the other thing that we started doing is we always have health fairs for our women's, men's, children's, and then we have an elders health fair. And we started getting a table at the health fair and we made it a required passport stop so that we could give out the information to our patients. I would sit there with another one of my staff members and I would take my laptop and I'm like, great, let's go ahead and get you scheduled for that exam right now. And so, it was meeting the patients where they were. It was getting the message out to them via social media and working with our providers.
Yeah. Well, here's the part that I think is always the most fascinating. So just high level, you want to share some of the results you saw? Because when I first saw it, I actually thought it was like a transposed number. Go ahead.
So we achieved in a 12-month period a 56.5%, and I'm counting that % increase in screening exams. We doubled our CT low-dose lung cancer screenings. Calcium scores increased by 400%. Our screening mammograms increased 8.7%. Of course, we didn't have any baseline for ABUS, but we did 660 ABUS exams from April. That technology went live in April. So from April to December, we did 660 of those. And then bone density increased 27%. And now I'm excited because we are working with one of our women's health providers. He has started a menopausal, perimenopausal clinic. And so we are going in and kind of presenting on bone density, the difference between osteoporosis and osteopenia. And you can come and get a bone density scan. And so we have a yellow belt project this year and really deep diving into those bone densities to see how many patients are in need of a bone density and that we can get in.
Right. I mean, those results, it's first of all, I love that you know the numbers to the 0.5%. Right?
Exactly.
Because you should be proud of that. And your team must feel just so great. I mean, what an accomplishment for the health system to make that kind of impact, right? It shows the power of sort of collaboration, like you said, with multiple different service lines and different leaders and different people. But to me, it's amazing. It's amazing to hear those statistics. So let me ask you, like, as you start to do that, all of a sudden your volume goes up. Were there any things like unintended things that you realize, like, oh my goodness, now do I have enough people? Do I have access to handle all of this? Like, that's a pretty big jump in volume very rapidly. So I'm so curious, like, how was there anything the things you didn't realize or expect, or how you adjusted sort of as you moved forward on that?
I think one of the unintended consequences now is how am I going to top it this year? I don't think that I will ever top that Capstone project, but can we at least continue? Can we get those patients to come back this year or whenever they are needed, that follow-up exam needed? Can we at least maintain what we've managed to grow? We did have to evaluate our staffing models. We did have to assess our technologist capacity. We did look at refining some of our scheduling templates just to make sure that we weren't burning out techs. And then, I think those were our biggest challenges. But, we had the capacity to take it on. So it was a benefit to the techs and to myself and to the organization because we're really growing. And so it was a great opportunity.
Yeah, I love that. So looking back, are there anything that jumps out in terms of like, here's why we succeeded so well, or sort of the lessons learned, right? Anything you take away now and reflecting back, and obviously also going forward now, right? Just sort of, hey, this is what helped us get there. It really got us over the hump, or here's some things that I might do a little bit differently, or just as people are thinking outside now, hearing your story, right? So I'm sure you're going to get phone calls of people saying, you did what, right? And how did you get this done?
I think using the data, find the data and then use the data to your advantage. I am in a very antiquated EHR system, and so it was a very manual process for me, but once I was able to find the data, to use that data to my advantage. And then communication with the providers, communication with the patients, and then communication with senior leadership in the C-suite on historically, people think of screening exams as very low generating revenue, but then showing them that the paths that we are creating down the road. So whether it's follow-up CT scans because there was pulmonary nodules identified, or, referrals to cardiology, echocardiograms, referrals to oncology. So we could show those pathways that we created with the screening exam for future revenue and for more higher volume studies.
That's right. And I think also, and I'm sure you can validate what I'm going to say here too, is you create another level of trust with the community as well. And they actually see you as their partner in their healthcare journey. Right. And, it's nerve wracking to go in, but oftentimes you screen, you catch things early and you can change the outcomes of, all sorts of things that are going on. Right. In the community.
Absolutely. We had one CT low dose lung cancer screening, 100% asymptomatic patient, had nothing. There was something suspicious. That patient was referred to a surgeon, and the surgeon questioned, how did this exam even come about? And she was like, my clinic screens for it. And he goes, that exam saved your life. And so I was like, yes, that's why we did it.
That's right. And you're like, and there it is. Forget the money, forget the dollars. All it takes is that one. And it's amazing, right? The power of just that one example. And you probably have many more of those you're not even aware of that are happening now as the program is kind of sustained and rolling forward. So I know that's fantastic. Now, what about the teams? Like, I'm so curious. Did you do you do things now to celebrate with the teams? Are they understanding the impact they're having? Are they still bouncing ideas around of things they can do differently or they could create enhancing it? Are you still going out to the schools and the community and promoting and all those things?
Absolutely. They are all on board. I have the best team. I would put them up against anybody. They are all about it and they are all for it, especially when they identify something and they're like, we got it. We got it before it became a problem. And so I would absolutely, their enthusiasm is very infectious. They bought into my crazy ideas over and over again. And so I could not do what I do if I did not have this team. We would never have been this successful. They were all absolutely on board.
Yeah, that's great. I mean, we always say that's the key, and it sounds easy to say, hey, get your teams involved, but when you can unify around something simple and start to see results, and it gets people into why they came to take care of these patients in the first place, right? And just getting people to understand what you have available and getting them in. I love that. Now, also, I imagine you worked with the radiologists as well. Did you have a partner on that side? Do you have like contract radiologists, employed radiologists, or strong partners there? Are they heavily involved with you?
We have a contracted radiologist, and so he was absolutely involved. But partly because of this project, we have been able to bring a radiologist in-house. And so that will be happening in a few months. And that will allow us to expand our screening mammograms now to do diagnostic mammograms. And eventually we're looking at doing our own biopsies so that we're not having to refer those patients out. Now we're going to be growing that program. But, we had to have the data, we had to have the numbers to show that this was the next right step.
That's right. That's interesting. So originally then the screening program, you identify stuff and refer them elsewhere. Now you're actually generating enough volume where system can keep it even more local, reduce the travel for folks and go that route. And then you get radiologists who want to come and want to be part of that. Appreciating that they're very, the radiologist world, the professional side is very challenging, just finding people and bringing them in. But that's really interesting. I wouldn't even have thought of that, about a way to start to, you're almost creating a whole new service line or, a bunch of services for patients in the community, right?
Yes,
that
absolutely.
Next level of care as needed, which is, that's really interesting.
Mm-hmm. So now we're going to be expanding into the diagnostic world. I'm going to go next month to East Memphis and visit with Billy and her facility. Yeah. Okay. So I'm going to go steal a lot of great ideas from her and get our women's health kind of up a little bit more. Yeah, get it up and running, get it going.
Well, for the listeners that are out there, Billy McKee is another long-term AHRA member. She's been very involved. So I love you brought this up, though, because you sort of alluded to something that when you started this route, right? Sort of the power of networks as well, and how you were inspired by your classmates, and any small project is just good as your project. You don't have to compare against other folks. But I love that you just referenced like Billy and someone else who you've gotten to know. And the funny part is, knowing you've only been at AHRA for a couple of years, the fact that you know some of these folks, to me, is amazing. It just shows that you're connecting and you're networking, and just by being present, people are getting to know you as much. They probably want to learn as much from you as you can learn from them. I also remember you mentoring. We talked a little bit about this when we were in Houston. I don't remember why. I remember having a dialogue about mentoring, and you mentioned like you knew Cindy Winter as well, who's our president-elect that's coming in. And is that just, did you know her outside of AHRA or through AHRA, or where I'm driving is maybe answer that a little bit. And I'm just curious of your thoughts on mentors you've had in your life or people that have helped, whether that's AHRA or outside of AHRA. You're hitting on a really cool theme that gets me excited about the power of those relationships.
No, I met Cindy through AHRA, and I think it was in Orlando where I met her. But I met Jamie Coder through AHRA. I mean, my network has just exploded because of AHRA. I am so much more confident now because I know if I don't know the answer, somebody at AHRA does. I can either jump on the forum or I can text or email somebody and somebody will have the answer. And so I met Cindy. I met her briefly. I believe it was in Orlando. It could have been Indy, but Indy was such a whirlwind for me because of
Right,
like,
first
"Whoa,
one.
where am I?"
Right.
But yeah, I've met Cindy, and so I've kept in touch with her and, tried to steal ideas from her. I loved her quality programs. And so she put me in touch with her quality person. And so I am absolutely stealing ideas from them. And, you know, anybody that has a great idea, I love that we share those and you can take it and adapt it to your facility and steal ideas. It's encouraged through AHRA to steal ideas. Don't reinvent the wheel. Don't, there's no need to. Just find somebody that's gone through it and find what works for them and then adapt it to your facility and to your needs.
Yeah, it's great. It's great advice. I got to give you a shout out. Just now, there's so many things that resonate. So I remember you virtually came in to talk to the new class, right? The cohort this year's
Yes.
cohort at in Houston, and I don't know if you picked up on it, but I was there with Michael Coulter and Luann Colbreth, senior leaders at United Imaging, Alexis Kolak from my team who helps or support the program, and you were giving your talk, and at one point we're all looking at each other in the back, and we're like, is that Lisa? Like the same Lisa from a year ago? Not, and it wasn't that you were just quieter, right? We're like, she's doing amazing. We were all running around in the back. And I remember Luann went up to the front and was like, hold on a second, Lisa. Like, just so exciting to see you share that story and just be passionate about where you've come and just the impact you've had on AHRA and your peers. I hope you realize like they're learning a ton from you as well. That's why I was just so excited to get the chance to talk to you today. I think your article is going to be on our link in our content hub, right? Which kind of shares a summary of what we're talking about. So listeners out there, if you want to learn more, you can go to the link content at ahra.org and you can look up link and find Lisa's article. But yeah, I think that's great. It's great to see you kind of coming through all of this. And I just love the story you're sharing. It's great success, great examples of just taking that first step forward, right? Stepping out of your comfort zone a little. I mean, you kind of resonate in so many things we're trying to encourage folks to do throughout the association.
Well, I owe so much to AHRA and Leaders of Choice. Leaders of Choice, I think, was really the confident boost. It really gave me a huge confident boost. Being able, when we were in Houston and we were sitting around that table, and actually being able to connect with the other people in my cohort that we were, we all are facing a lot of the same challenges, radiologists, staffing, equipment, everybody is kind of facing the exact same challenges. And I love that AHRA brings us all together in a room to have those conversations and how can we fix it. And, I was lucky enough to get to go to the imaging conference and expo in San Antonio this last weekend. And Michelle was there, Melissa was there, Rachel was there, I was there. So 4 of us were able to reconnect again in San Antonio and get caught up. My class has also continued kind of the post Leaders of Choice program. So we meet quarterly on a call, and Sarah's done a presentation, I've done a presentation. So we're all kind of just passing the baton about, how can we continue to support each other? How can we continue to grow with each other? And so I love that my cohort has continued to meet at least quarterly. I miss the monthly check-ins, but, quarterly is fitting our schedules right now. So I do love that, the connections that you can make.
Yeah, I love that. I love hearing that. It makes me happy. I'm sure our partners at United are going to be happy about that. And hopefully it inspires to others that are out there. They've thought about wanting to be involved just in AHRA or that Leaders of Choice program. They think about applying. And I'm actually glad you teed that up. So I think we're going to open up applications. If not next week, it's in the first 2 weeks of March. You'll see the applications open for the next class. So any listeners that are out there, you can go to the AHRA website to learn more about the Leaders of Choice program. And just be on the lookout for the applications opening. And basically, as part of the applications, it's just you telling your story of, what are you looking for in your leadership development and growth? Do you have an idea of a program or some improvement effort you're trying to go through? As Lisa, as you said, you don't have to recreate the wheel and have the most unbelievable thing. Sometimes it's the basic stuff, right? And I know some folks last year said, I don't really have a project in mind, or we're really busy at the hospital right now. And, I don't know if I can get the time away from that. So I'm hoping people realize it doesn't have to be, groundbreaking all the time. Just the small little steps and the small little things can make a difference. And maybe you could speak to, at the end of the day, it wasn't horribly time consuming, right? It was what you wanted to put into it. I think just you mentioned you had monthly meetings where the group got together. You think you had some one-on-one meetings with David Waldron, right? I should have said that. A shout out to David who
Yes.
facilitates that for us. But it wasn't a terrible time, consumption for you, right?
No, it was once a month. It was a 1 hour virtual call. My time zone, it was, during lunch. So I would eat my sandwich and, listen to the presentation. So the small amount of time that you had to actually put into it was rewarded tenfold. So, the best part was going to Houston to United Imaging. That time was invaluable. You cannot put a value on the time in Houston.
Just because of the personal connection, to be able to be with people for 2 days and just, yeah.
Yes, absolutely. And, I just felt like it made the cohort so much stronger. So, that was the most time commitment was, getting away for 2 days to go to Houston, but it was absolutely worth it. Absolutely. 100%.
I can tell you, I was there in January with this year's group, and they had it was funny to watch. It was almost like the exact same thing happening again. The group just gelling, and they gelled pretty early on because we were able to get them together at the annual meeting last year.
Yes.
Sort of as an informal gathering with all of you as the alumni, get up and you saw the next class coming. So we'll do the same thing this year. We're excited to have you guys all there to cheer them on as they present their capstones. Anybody out there that's going to the annual meeting, if you want to meet some of the members and hear their stories, they will be presenting on Monday, July, I think it's the 13th or 14th. I'll get my dates mixed up, but it's the Monday of our annual meeting in Orlando again, which will be great. Yeah, like I said, so the applications open up in March. So hopefully we're going to encourage people to apply again, and we'll grab that 10 to 12 people and get them rolling. It should be great.
It was a great opportunity, and I will absolutely be there cheering this new group on. I can't wait to hear their capstones.
Yeah. Well, Lisa, I really appreciate you taking some time to catch up today. I think you have a great story just about how you've connected with AHRA, the power of just making the networks, about raising your hand to volunteer. I think your story about and just what your team is, kudos to your team for what the impact they've had on that community in Oklahoma City. And I think there's going to be a lot of folks reaching out, trying to understand a little more about how you did that and what you went about and some of the tricks and trades, which sounds like they're not too complicated, just finding those right people to partner with.
Yeah.
If people want to reach out to you, what's the easiest way, would you say, for them to get a hold of you directly?
Of course, you can find me on LinkedIn. You can also email me at lisa.w@okcic.com.
Perfect. And we'll post that up in the summary that goes with the podcast, this episode as well. So, all right. Well, thank you so much. And
Thank you.
To listeners, hope you enjoyed it. Thanks for listening to Medical Imaging Matters, a podcast from AHRA, the Association for Medical Imaging Management. If you have enjoyed today's episode, please be sure to subscribe, rate, and review. AHRA is proud to be the trusted association for medical imaging management professionals, offering career development programs, a comprehensive selection of educational conferences and seminars, networking opportunities, award-winning publications, the Certified Radiology CRA credential, and so much more. To discover all AHRA has to offer, visit our website at ahra.org. Until next time.